Hello, friends. Welcome to Health Talk Show. Today, I am introducing my old friend Monazza Ali. Monazza, it's been so many years that we have been able to catch up. So I'm delighted you are here today.
Yeah, no, me too. It's almost, I think, more than 25 years or
Yeah,
20 years actually
20
since we
years. 20
graduated.
years. Yeah, we
Yeah,
graduated in
yeah,
1999. I
yeah.
don't know. Is it 2000? Because our degree says 2000, but our classes finished in 99.
99. Yeah.
And since then, I've not been able to meet you or see you sometimes on Facebook, but the deeper connection that we are going to establish today for all of us, it means a lot. And thank you for taking the time. I know you're busy. Our lives are upside down because of the COVID-19, but I'm glad that you're here.
Yeah.
Okay,
No, thank
so Mona, you are currently a perinatal psychiatrist and you're working at a beautiful hospital called Sidra Medicine. We'll get into that. You're currently in Doha, Qatar,
Yeah.
um, and it is one of those places and on my list to visit. But tell me a little bit about, let's go back 20 years and tell
hmm
me, what did you do right after we finished our medical school?
Well, I mean, just after finishing the school, did the house job. I mean, so first 6 months I did in Fody Foundation in medicine, and then the later 6 months was in Holy Family in a general surgery. And so finished my house job in July and then got married. No, sorry, in August the house job was finished, and in end of July got married, and in August I um, went to UK
I
with my
know I've
husband.
seen pictures and I think I've met your husband. He's a sweet guy. I would love to meet him again. And
Yeah, sure.
so where in England? Where did you guys end up?
So my husband's from London. He's a Londoner, born, brought up in London. So my initial, like, I think about 5 years, I think I lived in London. And then I moved to Cambridge for my after passing club and stuff for when I got my training post. So I moved to Cambridge and then we settled down in Peterborough, just near the Cambridge. So then I had all my training done over there. And once I did my MRCSAG exams and finished my training qualifications, then this was the time to move again. So that was like around 2012. And then we decided, okay, now it's the time to make another move. And then we thought about moving overseas from there. And we end up in New Zealand.
All right, so let's go back a little bit. I have to do slowly to get through that because there's a lot of exciting stuff. Okay. You've
Yes,
always
yes.
been a progressive thinker. So when you moved from Pakistan to London, was there any sort of shock, anything that you were excited about that you actually loved being there? Uh, Give us some initial feelings of being in a new country.
I think it's interesting, Farhan. I mean, I will say I have kind of mixed emotions, to be honest.
Hmm.
I miss my country. I miss my people. And uh, I don't know. I mean, from the settle we came from the friends we enjoyed, I felt initially a bit lonely in London, though I had a lot of family there. But then you have to look at the positive side of the things, the opportunities. I mean, the fairness in the system, discipline, rules, and regulation. I think those slowly over the time they grow on you and they become a part of you. So there was. So I always, even now, I struggle both sides of the world. I mean, it has the good and it has the other. Negative, but not so far negative, like, you home is home by the end of the day. I mean, you are always be Pakistani, right? So you miss that part of it, but there's a lot I've learned and groomed, and I think today the way I am, the way I present, I think it's lots to do what I learned from there, to be honest.
I agree with you, and you're speaking of what we all feel when
Mm.
who we have, like, left our countries, our families back home. A part of us is always there. A part of us is liking this for life. So it's a struggle, but you're balancing it beautifully. Let me tell you that. I would like to ask you, who made the decision to become a physician? Was it your decision? Parents asking you to do?
I think I will refer to, I think most of us will have the common answer to that if we be honest to ourselves. I think family has to do a lot as well in this
Yeah.
thing. I think the era, I mean, I feel like the era we kind of grown up, I mean, there wasn't any more choices. Either to prove yourself, you have to do either a medicine or you have to be engineer or a pilot. I think that those three categories were the one, otherwise you're not deemed to be any good. But having said that, I actually wanted to do a medicine myself to go into the army, because that was the only way you can go into the army. And being a, I mean, obviously my dad was an army officer, grown up into the army environment, and I was fascinated by that uniform, army uniform, the sari thing. I mean, so that's the
Yeah, it's
only way
pretty
I thought I
attractive,
could.
I have to tell you. Yeah,
Yeah, I
it's
mean,
really
and
attractive.
I think it was not only the uniform. I always liked discipline,
Mm.
order, and that sort of thing. And I loved army, and I wanted to join the army. And that was my personal reason. One of the personal reasons was to do medicine, was to go in army. But then that crashed. I mean, like when my parents said, like, no, you're not gonna go to AMC. I mean, you have to go to the no army and stuff like that. So then obviously I came to the other way, but it is thought been engraved from the, I think, the start. So it's kind of mutual. I mean, family wishes and plus mine as well.
Okay, good. And tell me about just few words about Rawalpindi Medical College or School. Do you think that it was your first choice? I mean, of course, you wanted to be in a Army Medical College, but
Mm.
how did you like your time in RMC?
In terms of the RMC as my first choice, I think it was more on the geographical basis,
Yeah.
because my parents were posted in Gujranwala at that time, and my uh, family is based in Kashmir. I mean, so it was kind of like a middle and a kind of zone, and also I was expecting my parents, I mean, will move to the Rawalpindi as well. So that was, I think, more pretty much the choice of the RMC was. But the time of the RMC, oh gosh, like, I mean, I think it's a big part of my life. I have so many memories. It's just amazing to meet anyone who has a link with the RMC. And if you meet with your own class fellow, it's just cherry on the top. I mean, it's just, I think it's a golden era. I don't know wherever I will go, but that part of my life, I think, is the most beautiful part of my memory.
I envy that feeling, honestly. I mean, that you really embraced RMC for its good or bad, and you just enjoyed your time with your friends, and you made friends everywhere you went. I know you had
Mm.
friends ahead of us in juniors in our class, so I have to give you that credit. My question is, when you became a physician in England, you must have thought many things. You know, there's a lot of options, and we don't know exactly what we want to be. And you eventually decided to become a psychiatrist. How did that um, evolution happen? What did you
Mm.
discover?
I think it's a wonderful question, because I won't say, and I've never said that I'm a born psychiatrist. As you see few people and they will say, like, I wanted to be this, I wanted to be that. No, I think psychiatry and the GP was the two which were never been on my choice list. But when I went to UK, I think the choices were getting limited. I mean, the options at that time, particularly in 2000, 2001, there was a lot of competition and the jobs opportunities were very few. And to get on a training post as a fresh foreign graduate was a mission. So, and then, I mean, somebody recommended, why don't you do the psychiatry? And to start with, obviously, I said, okay, to do psychiatry, but what about psychiatry? I didn't felt that I had any knowledge of psychiatry, to be honest. I think foundation in psychiatry at college was very, very weak, almost to nothing. I think I bunked almost all of my clinical placements, and the lectures, we know the story. So though I've been captured quite a few times and deliver the lectures as, you remember, I'm okay, you're okay, something like that. Um, but I mean, two things after I did my attachment were the main reason that whether I should do psychiatry or not, which bothered me throughout, was that A, am I going to get the satisfaction which I wanted to get as being a doctor?
Hmm.
And that was honestly is that I want to see people getting better. And in my mindset, I mean, psychiatric patients are mad, like, pagal, and they're never going to get better. This is how the life is and stuff. And also, to be honest, in Pakistan, we haven't seen many psychiatric patients around us. We never acknowledge. I mean, at least in my personal experience, I never saw somebody depressed, psychotic, or heard about those things. I don't know where they're hidden in our community. So those were main thing. Is it going to be satisfying as being a doctor? So then, I mean, coming to taking up as a choice were, I think, advices of my two mentors, my two supervisors during my house job. One was Dr. Javed in Fauji Foundation. So when I was saying goodbyes to him, he knew obviously I'm going to eventually move to UK. So he said to Mona, I mean, just remember, I mean, explore your options, but don't wait too long. And just remember, to be something is better than being nothing. So don't wait too long that I want to do surgery, I want to do this, I want to do that. Don't waste your time. And the second from Dr. Asif Zafar, I mean, he said that opportunity doesn't knock your door, I mean, twice. So don't waste the opportunities you get. And I think third, me being like, I don't want to be left behind or be far in the race. And I saw, I mean, what were my options were. And it's not that it was easy to get into psychiatry, to be honest. But I think my luck and the praise from my parents, from everyone, and I think was together that it happened for me at the right time. So that's how I got into the psychiatry after doing the attachment and what I experienced there. I mean, talking to the people, that they're very normal. They're normal like us. And actually, the more I talk to the patients, I mean, during my attachment, I find out actually it's a product of society, how they've been treated as a child from the people around them. And they're just unfortunate people. So I started to develop more sympathy for them. I started to understand, I mean, from where this mental illness is rooting and how they can be treated. And when I saw some amazing outcomes of very unwell people in just 1 month attachment, it kind of convinced me, no, I mean, I can do it. And then second, I mean, like my dad said, like, you need to look at yourself. And I think I felt like I got some skills which helped me. I mean, to develop the sympathy and understanding that I think I can listen to people. I can feel it. I mean, where it goes negative, I mean, in one way, because it gets emotionally overwhelmed. But on the other hand, I think it's really helped me to build that bond and connection with my patients. And then there was no turning away from there.
You have brought up several good points. You brought up the point of our society not recognizing mental health problem, a real problem. When I'm listening to you, it comes to me that all of us are mental health issues. We carry mental health issues, all of us, until and unless we are willing to admit it. And we are able to understand that being depressed is is a phase of your day. Could be you could be depressed, and recognizing those and finding looking for help is important, and our society needs to open up around that topic. You also mentioned something very meaningful, which is that a lot of mental health problems are product of society. And I think that is your uniqueness. I don't know
Mm,
if you understand or not, but being empathetic and being able to recognize is what God took you
mm,
to this path of psychiatry and helping people what you can help. And
sure.
you are in Western world. There's so many mental health issues that are being recognized and brought up, and now the rest of the world is looking up. Yeah, we have that too. So
Mm-hmm,
um, I I want to thank you for saying all the right things and being honest that you were not born psychiatrist, but you actually embraced it, and you used your uh, your nature's gifts, God's gifts, which are in your nature. Use them to help your patients. Let me ask you, you have said that you went to Cambridge, and is it 5 years or 6 years psychiatry training in
six
UK?
years
6 years, okay.
Yeah.
And when you graduate, what title do you get? Is it like a board certification like we have in the United States?
So what we have it like equivalent, like, you guys have in America, like after in our first 3 years of our training, we have to do the college examination.
Okay,
And once we finish that, and I think that's kind of a time when in US you get the board certification.
yeah,
So we get a membership of the college.
okay.
And then after that, we do the higher training for 3 years. And that is equivalent to your fellowship program.
Interesting. So it's kind of a,
Yeah.
so you, what is your specialty training in, I want to
So
know, is
I
it the
trained in
perinatal?
no, no. So I trained as a psychiatrist in the general adult.
Okay,
So you have like, old age, adult, child, and further branches of psychiatry. So I'm general adult psychiatrist, and then I've got super specialty is like a perinatal psychiatry, which
okay.
is like dealing with the women's from the time they conceive up till 1 month postnatal period, their mental health issues.
Wow, that's a roller coaster of emotions, that time period. I remember, when we were expecting our first kid, and this time is we see women going through so much emotional challenges, and what you do is really unique. Take us through your journey in New Zealand. You said you when you graduated, board certification. Soon after, you went out to work in New Zealand. So, what was that life about?
So New Zealand, I mean, was amazing experience. A place we call like heaven on earth, and place where I will strongly recommend everyone to at least visit once in a lifetime, at least. If you can't work there, at least do visit place. So it was like I think it became like a home for us. The people are beautiful over there. They are so much helpful, very calm, very welcoming, and immediately you feel like that part of the family. And in New Zealand, people usually say that lots of people, because they migrate there, I mean, from Europe and other places, so lots of people don't have the immediate family. So the locals they welcome you so much that they become a part of your family. So it's an amazing place to be. Um, and I don't know. I mean, the reason we moved out of the New Zealand just purely that it was too far away from our family. I mean, in UK and in Pakistan.
I have to tell you that you're not the only person who has actually shared their love of New Zealand. I want to ask you two questions specific to New Zealand. We know that they have spectacular views. Um,
Mhm.
how was the part of processing of joining New Zealand workforce? Was the England degree accepted there, or you had to take their exams again?
No, I mean, that's a fortunate bit. I mean, luckily, no exams or anything. You just have to go through the council. I mean, lots of paperwork. I mean, to
Hmm.
get the accreditation and equivalence. I mean, so the medical council approves you, and then you go straight to you apply for a consultant job. I mean, whatever your level is. But you have to be, I mean, like, psychiatrist or consultant trained from UK. You
Sure,
can't come in during the middle of the training. You can't
complete
just
your
come
training.
after. Yeah, a complete training. You should have it. Then it's no problem. If you leave in the middle and come after 3 years, then you have to start from scratch, from all over, like from the year one and exams and stuff like that. The
What did your
system is very,
kids
sorry.
system is? So go ahead, go ahead. Sorry.
So I was just saying, I mean, the working system is very much like a national health system of UK.
Okay, it is
So they
okay.
kind of
Yeah.
follow the same thing. So same principle. Yeah.
So that's what my next question was, that the insurance-based system or national health system. Um, so your kids, by that time, how many kids you have at that time?
I moved with 3 boys
Three
at
boys,
that
okay.
time. Yeah.
And
So I mean, the little one was about 14 months old. I think the eldest was 10, and the middle one was 6. So yeah, so 3 boys, and that's what my very first experience was. After 30+ hour flight from UK with the layover and the stuff, when I finally landed in New Zealand, I mean, I was in tears myself. I was exhausted with the little baby with the stuffed, kind of nose, and crying, and I had no milk because I was so scared, with the immigration process, that I just took everything away so that I don't want to carry any food items with me. So the baby was crying, the other two was falling over each other, sleep. They were so tired. So this immigration officer came to me and said, "Ma'am, you just look after your baby and just don't worry about anything." He took my baby bag from me and a trolley, and he just took the boys, and he said, and he filled up my cards. And he just said, like, "Welcome to New Zealand. Just don't leave us here. I mean, stay with us." And then he handed over me to the other guys who helped pick up my luggage, cleared me to immigration, and then handed over to us to my husband, who was waiting outside. Where
Well,
in the world this happens?
this is a
And it's not,
phenomenal, yeah,
yeah,
story. Don't expect that ever in United
no.
States at
And
JFK.
Farhan,
Oh
this
my
is,
gosh.
yeah, and Farhan, this is not it's not a first time. It has happened again and again. I mean, every time, I mean, I traveled a lot while I was in New Zealand, and every time I was coming back, I had wonderful experience dealing with these people starting from the airport.
Extraordinary
So,
human beings.
and
Yeah.
forget about the people you meet in the town, in the shopping malls. I mean, forget about that. They all are so welcoming.
Well, we'll get into a little bit of fun side of your life in New Zealand, because there's a lot of outdoor activities people tell
Hmm.
me that they do and stuff. So, what brought you to now this 7-star hotel that you work in, and you call it a hospital, Sudra Medicine? I looked up online. I was like, man, my hospital is like a tiny, um, um, a place in front of that huge building. So
Yeah,
what
I
brought
think
you
very
there?
yeah, I think that's a fact. Very few places, I think, in the world matches to the caliber of this hospital in the building wise, and but it's also in terms of the what it's providing in terms of pediatric care, and maternal care to the patients. It's amazing. I've not seen it again anywhere else. Um, so it's interesting. I mean, in 2013, as I said, like, I moved to New Zealand, and it was far, far away. And my dad sends me in 2014, January, February time, he sends me this job offer, which says female psychiatrist required in Qatar.
Oh
And
my
he sends me,
God.
say like, "Beta, ye aapke liye hai." I was like, I mean, and then with this, all the requirements are this many years experience, this degree, this, like, they want the best, nothing less than the best. And I was just year one consultant, and my dad said, "Nahi, ye inko female psychiatrist chahiye, so this is a job for you. You apply for it." I said, "Okay, we are still in the hotel. I mean, we're not even settled in New Zealand. You're asking me to move to Qatar."
Oh my
But
gosh.
then I said, like, okay, there's no harm in applying for it. So I applied it online for that job, and I got an answer: "Sorry, we will contact you at the moment." I mean, uh, very standard
So
sort of thing.
yeah,
You're not
yeah, yeah. So
successful.
yeah, yeah.
But the reality was the hospital was actually not even open at that time. It opened after a few years later. There was a delay in the opening of the hospital. So I forgot about it altogether. And then we kind of did, was continue our life in New Zealand. In between, Faisal came for a year or so in Qatar. I mean, on a project, he worked here. And then he has to come back because we were alone in New Zealand. And then after 4 years, the pressure from the family was growing that, we're too far away, and we were just not mentally able to settle down with that guilt that, my parents are in Pakistan, Faisal's parents are in UK. If God forbid something happens, we are so far away. So we were not able to mentally settle down, and we thought, okay, let's move to Australia. At least there are more direct flights. So we were not ready to go back to UK. So, okay, let's try Australia. So while we're doing that, so I had an offer from Sydney. These Qatar people contact me and they say, "Are you still interested?" I said,
Wow.
"Oops, okay." and okay, we'd like to interview you. And the next day, I mean, I had an interview, and then we gone through the process, and after 2 weeks they offered me a job. And so I have to make a decision to go Sydney or to
Sydney,
go to
yeah.
Qatar.
Oh my God,
So
that's exciting.
but then, to be honest, purely for our parents' sake, I mean, to be close, I mean, I thought it's a God gifted opportunity. um, um, and I just didn't want to mess it up. And it came from nowhere. It's something I applied like almost 4 years ago, knocked on my door again. And so we took that opportunity to just not to feel guilty conscious later in the future. Okay, we'll go and experience Qatar.
Well, you said right from the beginning, your mentors told you that the when the opportunity knocks on your door, take it. And now let me ask you, is this your dream job? I mean, you gave up two really good jobs. You could have continued in New Zealand. You could have moved to Australia. You could have gone back to UK. You decided to come in Qatar. How is it life there now?
Yeah, I mean, Farhan, I mean, I think as I say to people that I'm very fortunate and very much privileged, and I can't thank enough to God. I think my path so far is being so smooth in my career in terms of it has happened at the right time for the right reason, and I have no regrets over it. So when I moved from UK to New Zealand, it was a new experience. So if I say if I was at start of my consultant zero, my experience and my profile actually rose up, not like a 0, 1, 2, 3. I had opportunity, the way I proved myself, the way I was rewarded. I went straight to, I think, 8 or 9. I mean, it was like a very steep learning curve for me. Immediately I was, I was like year one, my first year of proper consultant job. I had a 6 months locum job before. So I became a medical head for the general dental psychiatry, like you can say a deputy, like you have in US, like chiefs, right?
Yeah, chief of
So,
divisions.
so
Yeah.
yeah, division chief. So I become a chair of the divisions, kind of equivalent. And I told them, look, I don't have the experience, management experience. I'm just very new to this field. But they said, we have seen enough in you, and we trust you with what you got, and you can take that role. So I was given that role. Then I
Wow.
took them. Then I was working in the inpatient unit. They asked me to cover. We had some crisis there, and they asked, okay, we want you to go and manage that. And I had a wonderful, wonderful team in the inpatient, very stressful job, but wonderful team. And that gave me further opportunity to explore my management skills. Then I became the senior lecturer at the Otago University. So I got medical students came under my umbrella, their training. And then along with that, I got the training of the junior doctors specializing in psychiatry. So all that was amazing. And I think when I look back, I mean, I did that for almost 4 years. So it was pretty much kind of becoming a routine. I got management experience, I got teaching experience, I got all that. It wasn't going any further in any further direction. Then this opportunity, when it came, I think it has taken my life to a different dimension.
Yeah.
So I have no regrets. I mean, coming here, it has given me international exposure. So I'm working in psychiatry, and now we are working in our partnership in US with the World Health Psychiatric Associations. We're working with the Marseille, which is like a perinatal psychiatry organization in the world. It has like a US Marseille, Australian Marseille, all the locals are international. So it's give us like give us a very
Global perspective on things, and
global
and and
perspective.
reach out globally.
Yeah, I mean, and I've done, in Pakistan, we got lots of opportunities to go to do things with the RMC, to go with the Psychiatric Association in Pakistan, I mean, to help them out and present there. I mean, so it has taken it again into a different level. And the perinatal become more of my specialty here. Before I was doing all the general adult, and perinatal was part of it, but now I'm just doing perinatal. So it has just opened up a new avenue, and we are doing the research and we are advocating for this in not only in the Middle East, but actually in the around the world, in the
Around the world,
Australia,
yeah.
in New Zealand. Yeah, so it's so I have not at all a single regret in terms of my job. It's a huge job satisfaction I have here, and I got, again, I'm very blessed. I have a wonderful department. I mean, our chair, chiefs. I mean, so it's an American kind of setup. So we got a chief and we got chairs and we got divisions and stuff. So it's amazing. I mean, no
your
regrets at
your
all.
journey your journey is actually a incredible journey of life taking you from Rawalpindi Medical School to a new country, new world, where you discovered yourself becoming a psychiatrist and falling in love in the specialty you are, and finding the most vulnerable population, the perinatal population, and helping them, and now bringing your experience from New Zealand, England, and now in Qatar. I uh, I think it's been a quite exciting journey. My question is, um, as a physician now in um, Middle Eastern country,
Hmm.
but having access to globally, are there any current roadblocks that you see that culturally uh, are are something that you need to break and have people more embrace mental health, especially local population or Pakistani
Hmm.
population?
Oh yes, I think, I mean, I've seen most of the Pakistani cases in my life while while I've been here in the mid in Qatar.
Yeah,
So it has its challenges here,
yeah,
but interestingly, I found that, I mean, the women's, uh, I don't know what is the percentage of it, but the one who've been referred to us, they're actually very keen to seek help.
great.
So you have to keep in mind, I mean, our service is like kind of unique in a sense. It's the only one possibly in the Middle East itself. And so people are not aware of perinatal mental health issues. Even, I mean, I think in US, they don't have a specialist service perinatal as such. But though they're working in the perinatal kind of area, but they have not set up as such a separate services. So it's like quite a, so we are setting up from the scratch, the foundations. I mean, then you have to adopt culturally appropriate whatever pathways you're going to develop, procedures you're going to develop. It has to be culturally appropriate. There's certain things that you don't have any compulsory treatments in Qatar, in Middle East. It's only down to the guardianship. So there's no mental health act laws as such in practice yet here. So there are lots of challenges there where we think, or I think at times, okay, if I was in UK or New Zealand, my life was so much easier. It was just only 10 minutes job. But now I have to deal a lot more to convince and to make sure my patient is safe because of those barriers. But overall, I think there is a lot of awareness going on here. Mental health is on top of the agenda of the health ministry in Qatar, which is great, seeing that. And actually our team, our division chief, she's leading the new perinatal mental health services development in Qatar. So as I said, opportunities wise is great. I mean, people are more coming to and seeking help. The stigma is kind of breaking up, but yes, there are barriers. I mean, like, and I will say I've seen barriers in UK as well, and in the New Zealand as well. But that's something I think is universal.
Hmm. Good. I'm liking what you're sharing with us. In the Qatar, the health system, is that national health system too?
Yes,
It
yes, they
is
do
okay.
have a,
So people
yeah,
have access to care. It's not that because of money they won't send their loved ones to be seen by doctors. It
no.
must be challenging at partly. It's challenging as a, especially if somebody's pregnant and you really limited in prescribing them medication. So you give them a lot of mental support, counseling. Do you have support system for psychotherapist and other support system there?
Yes, of course. I mean, because you can't go without the therapy services. So
Okay.
we have like a very like PhD qualified psychologist in our team. As I said, I mean, that's what makes it so much different. The people who are in our team are highly, highly qualified.
Good.
So the care is exceptional. I mean, I think I sometimes I say like we got. I don't think so. We could deliver that level of the care in any other part. Maybe partially because resources as well.
Resources, rich,
So
rich
yeah.
resources. Yeah.
So, but what we struggle is in terms of we don't have established like a social care system, like a social, in the community. That's the
Mm.
area which we lacking in the Middle East. But on the other hand, the family support replaces that.
Sure, they have a strong family support. If there's no, they
Yeah.
don't have social services available. I read
Yeah.
a book or somebody mentioned that in Africa, when they don't have a lot of mental health services available, they use their grandmoms to be the mental health services or social agents, to be an ear to hear, listen to people's pains, and they would go walk around
Mm-hmm.
and knock on the door, and a woman will come and talk to that lady and let her know her worries, and she would give them a piece of advice that they've been
Yeah.
trained by psychiatrists and it's helped. So that's formula applies there too. How COVID-19 is affecting mental health in your region?
So, I mean, obviously, it's a very anxiety provoking.
Yeah,
People are really worried about, the safety and what's going to happen. In particular, in our populations, the women are very much worried about from like what's going to happen to their loved one if they get sick. What's going to happen to them, to the baby? So we have seen huge escalation in terms of increasing anxiety, not only, I mean, in our patients, but also in the healthcare workers, in the and then in friends and family and people around us who I know who call and they talk about the anxieties around it. So I think that's a huge challenge. The COVID-19, the physical side of the thing. The other major one is the mental health side of the things.
yeah. A lot of people here have been talking about that there would be a PTSD equivalent disease in healthcare workers who were working because could not quit, but also just like warriors, soldiers who go out on a war field and they don't want to quit, but they're afraid and they come back with a lot of PTSD symptoms, especially in United
Yeah.
States veterans. We see that they're
Yeah.
talking about that. Is that something you think is real? Is it just too
I mean, of
much?
course, Farhan. I mean, I've seen your video where you talked about that you volunteered and you went to the COVID positive
Mhm.
ward or something set up.
Yeah,
So,
yeah,
so
yeah, yeah,
you had a bit of taster of that,
yeah,
right?
yeah,
But
yeah,
then we have people who are working with the COVID-19 in the situations much worse kind of situations
yeah.
where they're working because of their work ethics. I mean, they wanted to make difference or their job risk or whatever the reasons are, they're doing it. And it's a huge trauma. I mean,
Yeah.
to see people collapsing within in front of your eyes just like that, and then you're worrying about your health, your children's health, and stuff like that. So I'm not surprised that the PTSD is going to be a challenge in the future in our co-workers, in our colleagues around who are more frontliner. I mean, dealing with this issue. I mean, I
Well,
have colleagues. I mean, who actually have like siblings or children or partners working in UK, for example, and they're here, and they have so much like a panic attacks and things that they actually couldn't do their job here for that reason.
wow.
Because they're worried about what's going to happen to them. We got so many people we know in UK who have passed away. They were young in their 30s, no health issues. They were the frontliners in the medical specialty. So it has created lots and lots of anxiety. And I mean, I'll be honest, I had initially, to be honest, tight chest and feeling like kind of like feeling because I was alone in the department. My boss was stuck, in abroad. My other colleagues were stuck in abroad. So I was there by myself, and you have to go to, and at those early days, you don't know what's going to happen.
Yeah.
So, and you're worrying about kids and stuff. So, but then obviously with the time, it kind of got better, and you have to deal
Yeah,
with
we're
it.
learning. Yeah. Well,
Yeah.
thank you for sharing all of these, the real life challenges and making yourself part of this bigger effort to help our all, mental health. Any any life advice or any advice from your aspect to that you would like to share with your colleagues, your friends on this forum before we finish our professional talk that you would like us to do?
Yeah, sure, Farhan. I mean, I think I would like to talk, I mean, just briefly about, because perinatal, that's what I'm doing now, and I'm
Hmm.
very passionate about it.
Yeah.
So I will say to the colleagues and to the friends and family and wherever they can advocate it, look, childbirth is a very like happy moment of joy and thing, but it could be a very traumatic and sad uh, time as well for the woman. So please look at from the woman's perspective. And people ask what causes the perinatal mental health issues, especially postnatal depression. Is there any one factor which is causing it? Is hormones? You know, usual concept is hormones causing the depression. No, it's not. It's a combination of the factors which causes it. And the three main ones are, I mean, which which is very interesting. They all related to the people around, like social interaction, social isolation, and the perceived social support. And the perceived social support is the top utmost factor which is causing the depression or mental health issues in the women, especially around in this period. So why? And people don't understand that. Okay, what does that mean? From it means that, okay, you realizing, okay, you think, okay, oh, okay, she's tired, she's feeling low. You have your own person, but have you asked the woman, how are you? What can we do for you? Do you need any help? So despite having 10 people around her ready to help, but not asking the woman what sort of help she needs, what how she is feeling, so she's lacking that support what she requires. So please, I mean, do explore around it, and especially if you see the woman, especially my colleagues working in gynae or more like in obstetric side, or in a general practice they're working, and, or in any other specialty, if they're dealing with a pregnant woman, ask just two questions to screen it. One, are you able to enjoy things as before, especially in the last 2 weeks, because that's the kind of diagnostic criteria for depression for symptom is. And the second, do you feel sad? If in the last 2 weeks, those two questions are the screening questions. If they come positive, then it's your job and it's your duty of care to refer them to and direct them to the towards the appropriate help, whatever is available in your setup. And it can be done.
Beautiful. I
You don't need to be a psychiatrist. It could be a health visitor, it could be a nurse, it could be anyone.
Well, these are some phenomenal advices and tips that you have given us, because we don't think about that. Especially sometimes men, when they find their wives or loved ones depressed, they feel like, okay, maybe I should leave her alone, and
Mhm.
they try to engage themselves outside, and that keeps the affected person even more lonelier, and feel
Mhm.
like that they've been been left alone. So these are valuable advices.
Yeah.
Thank you so much. Okay, so this will conclude our professional session. Thank you.